Hi, I'm Dr. Harry Schick. I've been in practice for 35 years. I want to welcome you to our website for peripheral neuropathy. I want to congratulate you on being here and on watching these videos. When patients come to us, they really want to know two things. They want to know how they got this way, and more importantly, what can be done. I want to tell you, you're not going to get all the answers here on this short video, but afterwards you will have the opportunity to watch our full-length video where you can get all that information and learn what you can do. So if you've been suffering with peripheral neuropathy, I know that it's been very difficult. It can affect your walking. For some people, it's in their hands. It can create balance problems. Ultimately, it will create energy problems, and even can be related to issues such as memory. Now, folks, there's a world of difference between how we do things here and how you may have been treated in a traditional medical office where they rely predominantly on medication. Here, we're going to look to find out why you have the problem and what specifically can be done for you. Now, you're not going to hear this elsewhere. You may have already tried a lot, but I would like you to watch our full-length video and learn what we have found and what the next steps are for you. I just say, ask yourself, is this the way you want to live the rest of your life, or do you want to find something new? Look around the website after the video, and you'll see testimonials of people like you who have gotten help and have gotten the relief that they wanted. I'm Dr. Harry Schick. The full-length video will be on next. I look forward to seeing you soon. Hi, I'm Dr. Harry Schick. I'm talking to you today from Highland Park, New Jersey, with High Point Health Solutions, and today we're going to discuss peripheral neuropathy. Now, there's three things that I want you to get from our conversation today. One is I want you to understand exactly what peripheral neuropathy is. Two, I want you to know what can be done for it. And three, I want you to understand the first steps for you to take in order to get yourself out of your peripheral neuropathy nightmare, to help yourself or to help someone close to you. So I'm going to welcome you, and we're going to discuss today information that will make your life better. So, peripheral neuropathy, what is it? We need to understand what it is. We need to understand what causes it, and we need to know what can be done. So what exactly does peripheral neuropathy mean? Well, peripheral has to do with something being outside. You may have heard of peripheral vision, which is a vision which is outside your central vision. But peripheral neuropathy talks about nerves that are not part of your central nervous system, the nerves that are on the outside of the central nervous system, like in your hands or in your feet. Neuro, because peripheral neuropathy, neuro has to do with nerves, and pathy means abnormal. So peripheral neuropathy has to do with something abnormal going on with nerves outside of your central nervous system. I want to tell you that it's very common. I have close friends who've had it, have had family members, which is one of the reasons that I have a passion for helping people with it, because people very near and dear to me and close to me have suffered from it, and thankfully I've been able to help them. It affects 20 million Americans. You can think of it like the electrical wiring in your body breaking down. And your feet at this point, or your hands, but predominantly it has to do with feet, cannot communicate properly with the brain any longer, and then the brain can't communicate with your feet. So there's something going on with the wiring, for the most part, between your brain and either your hands or your feet. Now, there are 10 warning signs of peripheral neuropathy. Some of these you may have, but there are other signs that people don't realize actually do point to a situation of PN, or peripheral neuropathy. You can have numbness, where you actually can't feel your feet or your toes. You can have burning feet, which is terrible when people say they're walking around and they feel like their feet are hot, or their socks feel like they're on fire. They may even have a wet feeling in there, as if their socks have gotten wet. Cramping in your toes or your feet or your legs. You may wake up in the middle of the night with the cramping. You may be walking and all of a sudden have to stop. Some people, if they move their foot in a certain way, they know that they're going to get a cramp. Sharp electric pain, where the person may be walking, or even in the middle of the night, lying down, all of a sudden they'll wake up with a jolt, as if they've gotten a spark of electricity through them. It can be pain when walking. With some people, when they first start walking, they have pain. Other people, they walk for a while, and then it sets on almost like clockwork. They know if they walk 10 feet, 20 feet, a half a mile, whatever it is, at some point they're going to get it. Some people have difficulty sleeping because of leg discomfort. Right? They wake up, they come in, they'll tell me, Doc, every night around 3 o'clock in the morning I wake up with my feet aching or burning, or I fall asleep, and for sure, no matter what time I go to sleep, 2 hours later, I'm up with problems. You may have prickling or tingling feelings as if there's ants crawling on your feet and legs, or as if somebody's got a little pin and they're touching your feet. Loss of balance and falling. Now, a lot of people don't realize this is actually part of peripheral neuropathy. If you can't feel your feet, folks, the messages are not going to get up to your brain. So when that happens, you're very prone to falling. And we know that as people age, although it can happen at any age, as people age, falling is a tremendous problem. Weakness, where people just cannot, they can't walk the way they could, or they just, they say, I go to the mall and 5 minutes later I'm just like, oh, I'm so tired, I'm fatigued. And also swelling. You see, you can have swelling above the ankle, where you take your socks off and you see that little line around your socks. This is part of it. Or your feet actually swell you. Some of you I know have had to buy bigger shoes because you can't fit into the shoes they used to have. So these are all signs of peripheral neuropathy. And the symptoms depend. So you say, well, how could all these things be the same issue? How can these things all be peripheral neuropathy? Well, the symptoms depend on which nerves are being involved. From your feet up to your brain and back down, there's lots of different nerves. You have nerves that carry sensory fibers. Those are the ones that if you feel something, right? There are those that are motor, that have to do with the muscles. And there are those that carry information to the blood vessels. This is called part of your autonomic nervous system. That's why you may get swelling or some of the other things involved with peripheral neuropathy. Now, if you get sensory changes, this is damage due to sensory fibers. This is where you get resulting in burning sensation or nerve pain or tingling and numbness. Some people I know, you see them, they're walking around, they're constantly shaking their feet or shaking their hands. They're trying to get their hands to wake up, which you're not going to get by doing this for any more than a second or two, because it's not going to, the message is just not getting to the brain. The fibers that go to the brain are supposed to travel at 240 miles an hour. And when they slow down, you get all of these kind of problems. So sensory changes often begin in the feet, and they progress upwards. I have a lot of people, they have tingling in their hands. So I say, well, how about your feet? They go, oh, yeah, I have that too. But that's been going on for 10 years. Nothing you can do about that. But my hands just started last week. Truth is, it's all part of the same problem. And we look to fix everything. We want to get the hands and feet working again. People can have movement difficulties due to peripheral neuropathy, because the fibers, again, going down can affect the muscles. It can make it difficulty with contracting the muscle or even getting the muscle to relax. So if you have a problem with contracting the muscle, it's going to be difficult walking. If you have a problem with the muscle relaxing, what are you going to get? You're going to possibly get spasms. And then people also going to see their muscle starts to atrophy. They look at their legs and they go, wow, my legs, they look like the legs of my grandfather when I was a kid, because the muscles start to atrophy in. So you get cramping and so forth, all of this from here. Now, peripheral neuropathy is a chronic illness. That means it didn't come on yesterday. It's been working, you've been working on it for a while. So all chronic illnesses are a combination of two basic things. You have a neurological problem. Now with peripheral neuropathy, that's obvious because the word neuro is in the word. So there's something wrong with the nerves. But what you may not have understood, folks, and you have to understand this because you're not going to get better otherwise, is that it's also a metabolic problem. In my estimation, it's about 40% metabolic. What does metabolic mean? Well, you're going to know more about that in a few minutes. But metabolic has to do with body chemistry, and the nutrition and the vitamins and the minerals and all that go down to all the electrolytes and so forth that feed the nerves. Okay, so nervous system. Your nervous system, your brain, your spinal cord inside your spine, and all the nerves that go out from the spine. That's the periphery. So we need proper metabolism or energy in order to have your nervous system working right. That's one of the reasons that the metabolic side is so important. Right? The nerves don't work by themselves. They need to be fed. So what are the leading causes of peripheral neuropathy? Now that we have a sense of what it is, what causes it? Well, I'm sorry to tell you that one of the leading causes are statin drugs, and we'll talk about this in a little bit, but I know a lot of you who have peripheral neuropathy are on statin drugs, and you're told that, if you don't keep taking your statin drugs, you're going to have a heart attack. So what's the choice, peripheral neuropathy or a heart attack? So I'm sure you'd rather have peripheral neuropathy, but I want to tell you there's a mid-ground, and there's a way that you can have both not a heart attack and also have your feet working. A damaged back for years can lead to scar tissue. So what happens here is that you have a problem, because think about it, actually I have a question for you. So where do the nerves in your feet start from? So a lot of people have a general idea, will say, well, they start from my back, right? The nerves on my back go down into my legs. And that's true, but the truth is they really start higher, right? Don't they start in your brain? All nerves in your body start from the brain. They have to go down the whole spine, through your neck, your mid-back, down your lower back, down to your feet. So any compromise anywhere in there can affect the nerves in your feet. You know, we used to talk about it, I've been in practice 35 years, so years ago we used to talk about it simplistically. We used to call it the garden hose theory. If you step on the hose, no water's coming out the other end. And although obviously the nervous system is immensely more complicated than that, probably modern day garden hoses may be more complicated than that, but if you compromise or pinch something on one area, you're not going to get the juice flowing, the nerve flowing, the water flowing out the other end. Diabetes or type 2 insulin resistance, also a cause of peripheral neuropathy. You may have heard this. I say to some people, "Oh, you have peripheral neuropathy." They go, "No, I'm not. I don't have it. I'm not diabetic." It's gotten so commonly thought together. People think they have to go together. They don't, but they often do, and there's reasons for this. But when blood sugar is high and insulin level is high, and you'll see, I have another talk on diabetes, which you absolutely should watch if this is a problem for you, because unfortunately, I'm diverging now just for a moment. Unfortunately, diabetes is thought of as a blood sugar problem, and it's really an inflammation problem of the whole body, and that's where it gets connected in with peripheral neuropathy. I have many people who come in, they say they're diabetic, but that can't be causing their diabetes because their blood sugar is normal now, because they're handling it either naturally or through drugs. I tell them that's not the case. Diabetes is not just a blood sugar problem. Peripheral neuropathy can be caused by it, so you have to remember that. Chronic inflammation. If your nerves are on fire, it can be coming from other reasons. It could be foods, and I've had this so many times. Peripheral neuropathy often happens, it doesn't happen in children so much, right? It happens to people who've been living their life. And I tell them, look, I think that such and such a food can be contributing. And they say, how can that be? I've been eating it my whole life, and this only started a few years ago. But we get into that. So certain foods are inflammatory to the body. You can have infections, high insulin level, hormone imbalances also. We always see that. Metal toxicity I don't have on here. There's a number of other things we'll talk about. And of course, chemotherapy. I have plenty of patients who come in. They didn't have peripheral neuropathy until they began their work with their oncologist. They're getting chemotherapy, and now what can be done for them? Well, things can be done. Okay, so statin drugs, that was number one. And I want to just talk about that for a minute. So statins inhibit the formation of cholesterol. We know that, right? We know that that's the big thing that people are given it to for. And cholesterol makes up the sheath of the nerves. Did you know that? Do you know how much cholesterol goes to make up all your nerve cells, your brain, and everywhere else? So if you're limiting the amount of cholesterol overall in your body, and cholesterol is needed for the sheaths of your nerves, it makes sense that lowering your cholesterol to very, very low levels is going to potentially create peripheral neuropathy. Also, coenzyme Q10 is necessary for nerves to function. The statin drugs that you take don't just stop the formation of cholesterol, they also interfere with coenzyme Q10. So I know rarely, once in a while, I have somebody who was given a statin drug. They're also given coenzyme Q10 to kind of balance things out, but unfortunately things are more complicated than that. But bottom line is statin drugs are a leading cause of peripheral neuropathy. And if you're on a statin drug, it doesn't mean that's the reason, but we have to investigate and find out. And if it is the reason, then we have to talk and discuss with you, and you discuss with your prescribing physician what alternatives there are. But believe me, I have to say, folks, probably 50% of the people who come into me with peripheral neuropathy are on statin drugs, and we help them also. So a study from the Neurology Journal, May 2002, shows that statin drugs increase the possibility of peripheral neuropathy by 16 times. That's why so many of my patients have it. Okay, number two, damaged lower back can contribute to peripheral neuropathy. What comes into a damaged low back? Well, stenosis, which is a narrowing of the spinal cord, disc bulging, herniated discs, degenerative disease. Again, most people with peripheral neuropathy, but they've been around for a while on planet Earth. They've been dealing with gravity for a while. Even if they have that back pain, a lot of times we find that they have some degeneration in their back, which can be causing. And as I said, degeneration in the neck can also cause it, because where does the nerve start from? They start up here. I always remember, when I think about this, I remember a story I read a long time ago in a newspaper. Somebody had gone in for surgery to a hospital, and the person got the wrong surgery. I forgot what they were supposed to have, but they wound up having their thyroid removed. And that wasn't why they went in. Of course, it's a horror. But when they interviewed afterwards, when they were talking to the person, they said, well, although it was a terrible thing, I have to tell you my leg pain went away after the thyroid was removed. How could that be? Well, the nerves to the legs start up here. I'm not recommending that, but it's something I always remember that shows the connection. So common traits of low back pain. Your lower spine is compressed, right? So whether you have bulging discs, stenosis, herniated discs, degenerate discs, I like to call it a compression syndrome. Because what it means is that instead of having this much room in your spine, you have this much. Just a few millimeters less, but there's no empty space in the body. So when you have a little less space down there, you're going to get compression on the nerves. A compressed nerve does not work properly. A lot of time, it leads to the numbness, the tingling, the pain in the feet, all the things that we're talking about. Because the nerves from here go right down to the feet. So what do we do with the compression syndrome? Decompression. We have the top technology that we use in the office. Spinal decompression is one of the many weapons used for peripheral neuropathy, because I want to tell you something, if you have peripheral neuropathy which is 20% caused by compression, or 30 or 40, whatever it is, unless we do decompression, you're not going to get the full result that you want. And you're watching this because you want the benefits of being able to walk around, not feel your feet, not wake up at night. You don't want tingling, you don't want to be worried about falling. These are all things I know that you want. This is one of the things in our arsenal to help you. Okay, diabetes and insulin resistance. We discussed that as a third trait or third cause of peripheral neuropathy. So nerves need a lot of energy to survive, right? Your nerves use up, when you eat and you take in nutrition, your nerves use the bulk of it. Glucose is the nerve source of energy, right? So whatever food you eat is broken ultimately down into glucose, and that glucose is used for the nerves. Now, you shouldn't be eating glucose. Your body will do the job. You eat a whole complex food and your body breaks it down. Insulin is a hormone that puts glucose into the nerve, right? So you have your nerve. Think of a nerve like the riverbank next to the river. You've got the blood flow. You think about the blood flow as being the river. So there's insulin and glucose in the river, and you want to get it onto the riverbank. Glucose cannot pop onto the riverbank by itself. Glucose can't get out of the bloodstream by itself. It needs a little escort, a carrier molecule, and that's insulin. So the purpose of insulin is to get the glucose where? Out of your bloodstream into the nerve cell. I think you're understanding this now, the importance of it. Okay, when you are diabetic or insulin resistant, glucose cannot adequately get into the nerve. So what's going to happen, folks? You're going to have a problem. So we have to deal with this. So you're starting to see, I think, you're starting to get the idea, this is complex, right? And we have to look at everything. Can we fix one or two things? No. Not if you're going to get the benefits that you want. If you want to feel better and walk better, right, and have your legs working like they used to, we have to look at everything. What about chronic inflammation? Inflammation means to ignite. I love this phrase, right? You cannot build a house if it's on fire. I tell that to people all the time. They come into me, they say, can you do this for me? I ask them point blank. I say, look, if your house is on fire, where do you go? Do you go to the fire department, or do you go to Home Depot to start buying stuff to rebuild your kitchen? No, I know where you're going. You're going right to the fire department. You dial 911. You cannot rebuild your kitchen while the house is on fire, can you? And you cannot rebuild your nerves while your nerves are on fire. So common causes of inflammation, food sensitivities. We use, for many people, a paleo diet, but that's a general. I like to be very specific. So if there are foods that are bothering you with your nerves, don't you want to know? Listen, think about this. If you knew that every time you ate potatoes it made your legs more numb, are you going to have French fries? I hope not. If you're watching the wrong video, if that's the way you are. No, you're going to cut those things out so you can get your health back. Whether it's corn, I don't know what it is. How are we going to find out? We have to test, right? We don't guess around here. We got to find out, because I don't want you avoiding a food you don't have to avoid. But I don't want you eating food, folks, that's causing you problems. You can have hidden gut infections, and we look for that. A lot of times, digestive problems go along with peripheral neuropathy. So many people will come in, they have digestive problems and peripheral neuropathy, and a lot of times when we fix their digestion, their peripheral neuropathy gets better. Now, I know none of you watching this have a lot of stress in your life, but I'm talking to maybe about your friends, right? No, I'm just kidding. So, of course, stress on planet Earth goes without saying. And cortisol, interesting, is the one hormone that as you get older, you have more and more cortisol because more and more stress over time. So sometimes we talk about ways to lower your cortisol, okay, in order to help the inflammation in your body. High insulin, again, we have to work with that in terms of your blood sugar levels and hormonal imbalances. Cortisol, for women, estrogen, testosterone imbalances, these can all be factors. Okay, so I think you're getting the idea, you're understanding me now when we're talking about there are many things involved right? And we can't, you come here, we're not looking at one, we're looking at everything. That's what we do. Metabolic causes need to be addressed if you're going to win the battle against peripheral neuropathy. So I mentioned tests. So one thing that we do is we do blood tests. Now, that's not unusual. I can't imagine any of you out there have never had a blood test. But I want to ask you this. Have you been told that your tests are normal, even though you don't feel well? Have you ever gone and said, everything is fine, right? Well, how can it be that everything is fine and you have problems? Well, there could be a couple of possibilities. The lab ranges that are used might be inaccurate. I'm going to give you an example of that in a minute. And the bell curves are used. So basically what's happening is that when your lab work is being done, when they tell you you're normal, they're not telling you that everything is fine in your body. They're telling you, and get this, okay? They're telling you that your blood work is as good as your neighbor's. The whole thing is based on that. It's crazy, right? So when you say your blood test is normal, that means that whatever lab you're using has taken an average of all the blood tests they've done, and they're telling you that yours is within the average range of all the blood tests they've done. Okay, now, have you ever been to a major blood drawing lab? You ever sat in their waiting room? Sometimes people sit there for hours, whatever. You ever sat there? You looked around, who's getting blood work? It's not the top of the line fittest and finest, right? It's people who are sick, majority of them are on medication. This is who you're being compared to. Doesn't make sense, but that's the way we do it. So when you're being told your lab is normal, really they're telling you it's average. Functional lab values are more sensitive to reveal the problem. So we want to know not if you're doing as good as your neighbor, but is it really working for you? So you can have an abnormal low value, abnormal high value. We want you in the middle here. Because if this is a real low value, and this is a real high value over here, if you fall in the yellow area here, you're going to be told, hey, everything is fine, don't worry about it. But it's not. So let's give an example. Let's look at glucose. Okay, so what do we have here? The functional ranges is between 85 and 100. That means that you need to be between 85 and 100 or your glucose is not normal. All right, now, traditional high-low ranges, this is based on what? This is based on your neighborhood. So most people from your neighborhood who go in to get it done, they're somewhere between 65 and 110. Okay, so if they tell you you're 70, well, that's better than 65, so they're going to tell you you're normal. But is it functional for you? No. So when I get blood work in, I don't look at the reference ranges from your lab. I have to use what are called functional ranges. And so many times I'll say to somebody, this blood work, you got a few problems. They go, what are you talking about? I just went to my doctor, they told me everything was fine. I tell them, no, they told you everything was average, not fine. So you're understanding this? So we have to look at it. The other problem is a lot of times people didn't get enough blood work done. So sometimes I have to send people back to the lab to get more done. But at the very least, we look at what you have and analyze it from a functional perspective. So blood test is one kind of testing we do. There's more, but I want to show you not only the test that we do, but how we analyze it and how we look at it. Okay. So when you can't feel your feet, what happens to your brain? Okay, now think about this. When you can't feel your feet, what happens to your brain? Now, we're a very busy office. I've been here so many years, work all the time, and I see people, particularly as they age, are sitting there doing crossword puzzles or doing playing word games. I say, what do you really like this? They go, no, but it's good for my brain. And the truth is, it is good for your brain. However, you get much more benefit from walking than you do from any crossword puzzle you're going to do if your feet are working. Every time you take a step, there's receptors in your joint that fire up your leg to your brain that light your brain up, right? Much more than you're going to get from any crossword puzzle. Now, if when you walk, instead of getting 100% of firing to your brain, you're only getting 20%, what happens to your brain? There's no crossword puzzle in the world that's going to fix that. We have to fix your feet. So peripheral neuropathy is huge when it comes to brain functioning. Cut your nerve, change your brain study. Well, this is pretty much what I was talking to you about before. That is, if you don't have proper functioning going, stimulating your brain, loss of balance, memory loss, depression, anxiety, Alzheimer's. You know what? Interesting about Alzheimer's, which is a horrifying situation if you've ever been involved with it. Alzheimer's in some journals is now called diabetes of the brain because they know the connection between blood sugar levels in the body and what it does with brain function. But I want to tell you another thing that happens is that if you remember back, which I'm sure you do, that that if you have a problem with your blood sugar level, it affects your neuropathy. So now you see the connection. So blood sugar affects neuropathy, affects brain firing, and that's how it all connects back in with Alzheimer's, dementia, insomnia. I see it all the time, and it's horrifying. I tell somebody, if you can't, and even with people who are coming in for other problems, I always check their feet to see how their sense of feeling and vibration is in their feet. It's like a preventive test, like the lighthouse theory, to see what's going on with their brain. If I can fix their feet, besides they're being happy for their feet, I'm helping their brain. So what does a neuron need to revive and repair? Well, it needs glucose. We talked about that. It needs oxygen, and no inflammation. It needs all the things we talked about metabolically, but it needs activation. Your brain must be activated. So any part of your brain that is not continually activated starts to die off. Did you learn when you were in grade school? Did you learn a foreign language? Yeah. When you took the test, did you do well? I hope so. Can you speak the foreign language now? Probably not, unless you've been practicing, right? Why is that? You haven't been activating that part of your brain. A teacher once had told me there's no problem with trying to remember things. Just don't forget any of them. So as long as you keep activating that part of your brain, you're fine. But stop activating it and things go downhill. So in order to fix things in general with you, in order to work on this, we have to work very much on brain activation. So one of the ways we work on this, which is phenomenal, we use what's called pulsed electromagnetic frequencies. Okay, this is a MagneCharger Pro. This is electromagnetic frequencies that actually go into your body and not only help to heal and get your feet working better, but work on the whole body in terms of digestion, brain function, and nerve function. So anybody with peripheral neuropathy, this is another one of the things that we do. It stimulates the nerve electromagnetically, reduces pain, improves nerve and blood flow, stimulates the nerve biochemically, and so forth. Allows for greater metabolism, reduces inflammation. It's an unbelievable piece of equipment that I'm so happy that we got. So what else do? We also do laser therapy, because within the laser spectrum, there's certain wavelengths of laser light that help to stimulate nerve flow. So you're getting the idea now? So we have to lower the inflammation. We're talking about your metabolism, getting things balanced chemically. And once we get things balanced chemically, what do we have to do? We have to make sure activation is good. We talked about decompression before. Now I'm giving you a few other examples. A specific wavelength in a laser light goes into the nerve cells and stimulates energy production. This light also stimulates circulation and lymphatic drainage. The things that are out now are incredible, and you deserve to have them used with you. That's why I'm doing this. A lot of people aren't aware of these things which exist and which are so helpful. In addition to that, we use an essential fatty acid cream, which helps with inflammation. Other supplements may be given. Whatever. Listen, I think folks are getting the idea. Whatever we need to do, we're going to do. First, we have to totally understand what is going on, why, and then we have to provide what you need. So the key points, it takes many different things in order for us to correct peripheral neuropathy with you, not just one thing. You're not going to come in here and say, here, take this, or here, we're going to do this. I've never had it. I would love it, but I've never had it happen where somebody came in with peripheral neuropathy and I said, let's just do this and you'll be better. It doesn't happen. It's a complex, that's what makes it chronic. A chronic problem, almost by definition, needs a combination of things to get better. You must address both the underlying metabolic and neurological problem. We discussed that, and I think folks are getting an idea about how if you only do one or the other, unfortunately many people have had neither done, you get nowhere. The condition is progressive. Let's understand that for a minute. A chronic condition being progressive means it gets worse over time. Now, I'm not saying you don't have some days that are better than others. I know that you do. It kind of goes up and down like that, and it comes down. Now, the problem with chronic conditions is that people think they can predict it. They think that, yeah, I know I'm going down, but I'll work on this, maybe next month. I mean, I know I was here and I'm here, but unfortunately, chronic health conditions don't go like that. They unfortunately have precipitous drops from time to time where a person is like this, and then boom, they drop down. Now, I don't know, I can't predict where you are in that. All I know is that we got to get to work and get these things fixed. We have the most comprehensive peripheral neuropathy program there is. I haven't seen anything more than that, anyway. And we get great results. As you'll see, there's on the website we have testimonials of people who are just as happy as can be. Okay. I want to give you a summary now. Remember, in the beginning, I talked about three things I wanted. I wanted you to know what peripheral neuropathy is, and I wanted you to know what can be done about it, and then I wanted to talk about what you can do. So in summary, we're talking about comprehensive blood work at functional ranges to identify underlying conditions and causes. And then we're going to talk about what foods you need to be on. If there are foods that you're eating that are inflammatory, what are you going to do? You're going to eat the French fry? No, you're going to put it aside because you want your feet to work and you want your brain to work. And then there's other things we do in terms of spinal decompression, laser therapy, vibration therapy. I didn't even mention that. There's so much that we do depending on what your needs are. Okay. Now here comes the big question. How bad are you? The initial exam includes a complete neurological exam, including the Toronto scoring test. A normal score is 74. What's your score? Unless you had this done, you have no idea. But it's actually been quantified, and it's a beautiful testing where we can actually tell you, you're supposed to be 74, you're 70, you're 20, whatever it is, so we know where we need to get in order to have your nerves working better. Okay, so what's next? Action. I took action, I made the video for you, now it's time for your action. Make an appointment. So let's talk about what happens when you make an appointment with me, because I know that if you've gone this far, you're interested. So I want to now talk about what happens when you come in. Visit 1, we do a complete neurological evaluation. I hope I don't need to go into that any further. Without a neurological example for peripheral neuropathy, we get nowhere. So we have to know what is the condition of your nervous system. Review any existing labs you have. I'm going to ask you to bring in, if you've had blood work, I'm going to ask you to bring those labs in, and we will go over them together with what? I think you remember functional ranges, right? Not the average normal ranges. I'm going to give you a form to fill out, metabolic assessment form, and I'm going to ask you to bring in your spouse or significant other with you. I hope they're also watching this with you too. Because listen, I jam-packed in this information. This isn't close to what I could be telling you about. I want to give you a good taste of what's going on. Now you come in for an exam with me, and I do a whole exam, and I give you a tremendous amount of information about you particularly. You go home to your husband or wife, they say, well, what did he say? You're not going to be able, how are you going to be able to explain what I said there? So you bring them with you. That way, they're going to know what's going on. That's visit 1. Visit 2, case review if I accept your case. I said if. Do not accept everybody who comes in. There's a few things that have to be done. One, I feel I have to help you. And secondly, I have to feel like I have a willing partner with you. If I don't feel like you're going to do what it takes to get better, then we're not going to get started. We're going to overview and further complete and look at any other testing that needs to be done. So I may need more tests, and we'll talk about that. I'm going to go over the tests that we did from the previous time. We're going to review the neurological findings, and then I'm going to give you a treatment plan. Okay, I'm going to tell you from all the work that I did and all that I know with all the people I've seen, what I feel will take for you to get better. And again, please bring your spouse or significant other with you. Again, same story. If you're going to come in and somebody's going to ask you what happened, you're not going to be able to explain it. I just know this. What else do you need? I'm going to ask you to bring shorts or sweatpants and a t-shirt. If I'm going to do a complete neurological exam with you, I need to see what's going on with the skin. We're going to do tests on the skin, on your feet, on your legs. You're going to need to have all your paperwork filled out completely. There's a little bit of work on your side for this. You want to get better, you want your brain to get better, you want your feet to get better. You have to do a little bit of work. And again, as I said, bring your spouse or significant other. It must be important. I've said it 3 times now. I want this person with you so that they can help you and support you and know what's going on. Okay. I accept 5 new peripheral neuropathy patients per month. I want to tell you, I love working with peripheral neuropathy. I don't want an office full of peripheral neuropathy patients. I love a lot of the other things I do too. So 5 a month is a good amount for me to work with. The first 2 visits are $450. If you make an appointment after attending this workshop, I do workshops also, but after watching this video and you call, you get your first 2 visits for $75. All you have to do is tell them that you watched the video and you want the $75 price that was offered on it. Okay, now let's talk about commitments and insurance. Folks, I'm trying to answer all your questions. Okay, so and I know, like I said, 35 years, I got a pretty good idea what the majority of the questions are. So, for me to accept your case, you must be willing to make serious life changes. Otherwise, forget it. This is a lot of time and energy on my part and your part. If you say, nope, sorry, I'm eating French fries, no matter what you say, I know it's going to destroy my brain. I say, okay, have a nice life. It was nice to meet you. If anything changes, give me a call. But we're not starting. You have to take accountability for your health. Well, it kind of goes along with what that means, right? To take accountability for your health. This is your problem. It's your feet that aren't working. It's your problems that you're having. Okay, it's you that can't feel your feet, and you want to feel your feet. It's you that maybe you're finding yourself forgetful. These are problems for you. Okay, I'm going to help you, but you need to join in with me. We need to work together. Now let's talk about money, insurance, Medicare. May pay a small portion of the care. Sometimes they pay more than others, depending on the reason that you have the peripheral neuropathy. It will depend on how much your insurance will cover. But for most people, they can get care for as little as $200 to $300 per month over the course of their plan, even if the insurance doesn't work out. So that gives you some idea of what you'd be looking at. Okay, so we're closing here. Remember I said there were three things. I'm big into reviewing, as you can see. What is peripheral neuropathy? What can be done? And then what do you do? So 6 things for you to think about. On a scale of 1 to 10, how serious is your illness? Again, if you've been watching this long, unless you find me tremendously entertaining, it's probably a big problem for you. But if you don't come to my office and tell me it's about a 3, I don't work with 3s. Okay, you got to be on the other end of the spectrum. Where do you see yourself in 3 years? Okay, I'm going to tell you right now, as I mentioned before, if you have peripheral neuropathy, you have a degenerative chronic condition. I'm going to tell you where you are in 3 years. You're not going to be as good as you are today. So what is that going to mean for your life? Are you going to be able to run and play and pick up your children or your grandchildren? Are you going to be able to hold your job? You're going to be able to walk in the mall? You're going to be able to go to the baseball game and make your way up the bleachers to watch your children play. Maybe you're still very active. You're still going to be able to play racquetball. Probably not. Right? Are you going to have more issues of forgetting? You walk into a room and you forget why you went into the room? You have to think about that. How has it affected your relationships, your work, your ability to enjoy life? Think of 3 things you can do if you didn't have peripheral neuropathy. I gave you some examples, but if you didn't have it, your life would be different. And who says you have to still have it? Let's talk about that. Let's examine. Let's find out. And now, on a scale of 1 to 10, how serious are you about changing things? You know, your problem may be a 10 and you're only a 2 in terms of how important it is to you. Again, this is not the place for you. This is a place for people who have real problems, who want to get better. So I can only accept those people who are willing, who are committed. And if you're not truly committed to getting healthy, don't give us a call, don't sign up. You know, I'm glad you got the information, but this is for people who really want to get better. Okay, so I want to thank you very much. Again, High Point Health Solutions. You can email me if you have questions, highpointhealthsolutions@gmail.com. Give us a call. Our number is all over the website, 732-249-9800. Again, it's been a pleasure talking with you. I love doing this. I love talking about it. I do it because people need to know. You need to know. Listen, I'm talking to you now. You need to know why you have it. You need to know what you can do to get rid of it. And you need to make a decision to get your life better. I'm Dr. Harry Schick. Thank you very much.